For years, it's been a part of physicals for men of a certain age, the PSA test. But now an influential panel of specialists is recommending against the test being conducted in men over the age of 50. Dr. Raj Krishnamurthy of BU and Boston Medical Center is here. So what is the PSA?
So the PSA, prostate-specific antigen, is a blood test, and it's a blood test that we do often as part of a routine exam and as part of routine blood work in men over the age of 50, usually in men between 50 and 75. The hope was it would identify men who have prostate cancer in an age where you could actually do something about it and prevent death from it. The problem is it's not a perfect test.
And so that's why this panel came out with this recommendation. It said the test may be doing more harm than good. And yet there are still some doctors out there who are saying you should have it done. So why this controversy?
The main things that this expert, the U.S. Preventive Services Task Force, looked at were two big studies in thousands of men done in both the United States and in Europe. And the finding is men didn't live longer, and that's the concern. You asked also about what is the harm. So the testing itself causes worry and anxiety if your level is abnormal, your PSA blood test is abnormal, and it also causes procedures, biopsies that can be painful. It causes people to have surgery if that biopsy test is positive. And the question is, if we aren't prolonging life in that group of men, then what are we doing? Is it really helpful?
Dr. Krishnamurthy, thanks. And next week, we'll take a look at what men should do now. For continuing health news, stay with boston.com/health and the Daily Dose blog at boston.com/dailydose.